Question 1. Regulatory review indicates that a 7-year-old Labrador Retriever presents with acute onset of hind limb paresis and ataxia. Initial neurological examination reveals proprioceptive deficits in both pelvic limbs, hyperreflexia of the patellar reflexes, and normal withdrawal reflexes. Spinal radiographs are unremarkable for vertebral fractures or malformations. Given these findings, which of the following represents the most appropriate next step for the veterinary technician specialist to recommend to the attending veterinarian? Option A. Propose a trial of broad-spectrum anti-inflammatory medications and strict cage rest. Option B. Recommend advanced diagnostic imaging, such as magnetic resonance imaging, MRI, or computed tomography, CT, to further characterize the neurological lesion. Option C. Advise immediate surgical exploration of the spinal cord to identify and address the source of the neurological deficits. Option D. Suggest euthanasia due to the severity of the neurological signs and the potential for poor prognosis. Correct answer is B. Recommend advanced diagnostic imaging, such as magnetic resonance imaging, MRI, or computed tomography, CT, to further characterize the neurological lesion. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in veterinary neurology, requiring the veterinary technician specialist, VTS, to critically evaluate diagnostic findings and patient status to determine the appropriate next steps. The VTS must balance the potential benefits of advanced surgical intervention against the inherent risks and the patient's overall prognosis, all while adhering to established veterinary ethical principles and regulatory guidelines for patient care and informed consent. The challenge lies in synthesizing complex neurological data, understanding surgical limitations, and communicating effectively with the veterinary team and the client. Correct approach analysis. Recommending further diagnostic imaging, specifically advanced modalities like MRI or CT, is the best professional practice in this situation. This approach aligns with regulatory frameworks that mandate thorough diagnostic workups before recommending invasive procedures. It allows for a more precise localization and characterization of the neurological lesion, which is crucial for determining surgical candidacy and planning the procedure. This adheres to the ethical principle of do no harm by ensuring that surgery is only pursued when there is a high likelihood of success and benefit to the patient, based on comprehensive data. It also supports the principle of informed consent by providing the client with the most accurate information possible to make a decision. Incorrect approach is analysis. Suggesting immediate surgical intervention without further advanced imaging fails to meet the standard of care. This approach bypasses essential diagnostic steps, potentially leading to unnecessary surgery, increased patient risk, and financial burden on the client. Ethically, it violates the principle of beneficence by not ensuring the intervention is truly in the patient's best interest based on complete information. Regulatory frameworks emphasize evidence-based medicine, and proceeding without definitive diagnostics is contrary to this. Recommending euthanasia solely based on the initial clinical signs, without exploring all diagnostic and therapeutic options, is premature and ethically questionable. While euthanasia is a valid option in certain circumstances, it should be a last resort after all reasonable diagnostic and treatment avenues have been exhausted or deemed inappropriate. This approach fails to uphold the veterinarian's duty to provide care and explore all viable options for the patient's well-being. It also neglects the client's right to explore treatment possibilities. Advocating for conservative medical management without a definitive diagnosis or understanding of the underlying pathology is also inappropriate. While medical management is a cornerstone of veterinary neurology, its efficacy is highly dependent on the specific condition. Without further diagnostics, the VTS cannot confidently recommend a treatment plan that is likely to be effective, potentially leading to prolonged suffering for the patient and a false sense of security for the client. This could be seen as a failure to provide competent care. Professional reasoning. The professional decision-making process in such a scenario involves a systematic approach. 1. Comprehensive data gathering. Thoroughly review all available clinical history, physical examination findings, and initial diagnostic results. 2. Differential diagnosis generation. Based on the gathered data, formulate a list of potential neurological conditions. 3. Diagnostic plan development. Determine the most appropriate diagnostic tests to differentiate between the differentials and localize the lesion. This often involves advanced imaging in neurological cases. 4. Risk-benefit analysis. Once a diagnosis or strong suspicion is established, evaluate the risks and potential benefits of all available treatment options, including medical management, surgery, and palliative care. 5. Client communication and education. Clearly and compassionately communicate findings, diagnostic options, treatment recommendations, prognoses, and associated risks and costs to the client, ensuring they can make an informed decision. 6. Adherence to standards of care. Ensure all actions align with established veterinary neurological protocols and ethical guidelines. Question 2. Quality control measures reveal a significant variability in the thoroughness and documentation of neurological assessments performed by the veterinary team. To address this, what is the most appropriate next step for a veterinary technician specialist, VTS, in neurology? Option A. Initiate a comprehensive review of the current neurological assessment protocol, incorporating current literature and best practices, and facilitate team training on any necessary revisions. Option B. Remind all team members of the existing neurological assessment protocol and emphasize the importance of strict adherence during their next team meeting. Option C. Focus on individual performance reviews for technicians whose assessments appear less thorough, providing targeted feedback without altering the established protocol. Option D. Develop and implement a new personal neurological assessment protocol that the VTS will exclusively use for all neurology cases. The correct answer is A. Initiate a comprehensive review of the current neurological assessment protocol, incorporating current literature and best practices, and facilitate team training on any necessary revisions. Explanation. This scenario presents a professional challenge because the neurological assessment protocol, a cornerstone of accurate diagnosis and treatment planning in veterinary neurology, has been inconsistently applied. This inconsistency can lead to misinterpretation of findings, delayed or incorrect diagnoses, and ultimately, compromised patient care. The VTS Neurology is ethically and professionally obligated to ensure the highest standards of patient care, which includes adherence to established, evidence-based protocols. The correct approach represents best professional practice because it directly addresses the identified quality control issue by initiating a systematic review and potential revision of the existing neurological assessment protocol. This aligns with the VTS Neurology's role in advancing the specialty through evidence-based practice and continuous quality improvement. By engaging with the veterinary team, referencing current literature, and ensuring the protocol is comprehensive and standardized, the VTS Neurology upholds the ethical imperative to provide competent and compassionate care, as well as the professional responsibility to maintain and improve diagnostic and therapeutic standards within the field. This proactive and collaborative approach ensures that all team members are working with a unified, accurate, and up-to-date understanding of neurological assessment, thereby optimizing patient outcomes and minimizing the risk of diagnostic errors. An incorrect approach that involves simply reiterating the existing protocol without investigation fails to address the root cause of the inconsistency and risks, perpetuating suboptimal practices. This demonstrates a lack of commitment to quality improvement and may violate the ethical duty to provide the best possible care. Another incorrect approach, such as unilaterally implementing a new, unvalidated protocol without team consensus or evidence-based justification, undermines collaborative practice and could introduce new errors or inefficiencies. This bypasses established procedures for protocol development and validation, potentially leading to confusion and resistance from the veterinary team, and failing to meet the standards of professional conduct. A third incorrect approach, focusing solely on individual technician performance without examining the protocol itself, misses the systemic issue. This can lead to unfair performance evaluations and does not resolve the underlying problem of an inadequate or poorly understood protocol, thus failing to uphold the professional standard of ensuring consistent and accurate patient assessment. The professional reasoning process for similar situations should involve a systematic approach. First, acknowledging and investigating quality control findings. Second, evaluating the existing protocol against current best practices and literature. Third, engaging the veterinary team in a collaborative discussion to identify areas for improvement. Fourth, developing and implementing revised protocols with clear training and documentation. And finally, establishing ongoing monitoring to ensure sustained adherence and effectiveness. This iterative process of assessment, refinement, and evaluation is crucial for maintaining high standards of care in veterinary neurology. Question 3. Compliance review shows that a canine patient diagnosed with a suspected brainstem lesion is exhibiting fluctuating heart rates, intermittent pupil dilation and constriction, and periods of apparent gastrointestinal stasis. The veterinary technician specialist, VTS, in neurology is tasked with assessing the patient's autonomic nervous system status. Which of the following approaches best reflects the VTS's role in evaluating potential autonomic dysfunction in this context? Option A. Systematically assess vital signs, pupil reactivity, gastrointestinal and urinary bladder function, and observe for other signs of sympathetic or parasympathetic dysregulation, correlating these findings with the suspected neurological lesion to inform diagnostic and therapeutic planning. Option B. Assume all observed signs are direct manifestations of the brainstem lesion and focus solely on managing the primary neurological deficits. Option C. Attribute the fluctuating heart rate and pupil changes to patient anxiety without further investigation into autonomic pathways. Option D. Recommend immediate surgical intervention for the brainstem lesion without a comprehensive evaluation of autonomic system involvement. The correct answer is A. Systematically assess vital signs, pupil reactivity, gastrointestinal and urinary bladder function, and observe for other signs of sympathetic or parasympathetic dysregulation, correlating these findings with the suspected neurological lesion to inform diagnostic and therapeutic planning. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist, VTS, in neurology to interpret subtle clinical signs related to autonomic dysfunction in a patient with a known neurological condition. Differentiating between primary neurological deficits and secondary autonomic dysregulation, and understanding the implications of sympathetic versus parasympathetic over- or underactivity, is critical for appropriate patient management and communication with the veterinary neurologist. The VTS must apply their specialized knowledge to a complex clinical presentation, ensuring that diagnostic and therapeutic interventions are targeted and effective, while adhering to established veterinary practice standards. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical signs, correlating them with known autonomic nervous system (ANS) pathways and their potential disruption due to the underlying neurological disease. This includes assessing vital signs, heart rate, blood pressure, respiratory rate, temperature, pupil size and reactivity, gastrointestinal motility, urinary bladder function, and observing for signs of pain or distress that could be mediated by the ANS. The VTS must then synthesize this information to form a differential diagnosis for the autonomic dysfunction, considering whether it is primarily sympathetic or parasympathetic in nature, and how it impacts the patient's overall condition. This approach aligns with the VTS neurology certification's emphasis on advanced diagnostic interpretation and patient management, ensuring that care is evidence-based and tailored to the specific neurological patient. It demonstrates a commitment to understanding the intricate interplay between the central and autonomic nervous systems, a core competency for a VTS in neurology. Incorrect approach is analysis. One incorrect approach would be to solely focus on the primary neurological lesion without considering secondary autonomic effects. This fails to acknowledge the significant impact autonomic dysfunction can have on patient well-being and prognosis, potentially leading to delayed or inappropriate treatment of critical physiological derangements. This approach is ethically problematic as it neglects a crucial aspect of patient care, potentially violating the duty to provide competent and comprehensive veterinary medical care. Another incorrect approach would be to attribute all observed clinical signs to the primary neurological disease without investigating potential autonomic involvement. This demonstrates a lack of specialized knowledge in neuroneurology and autonomic physiology, which is a core expectation for a VTS. It could lead to misdiagnosis and ineffective treatment strategies, failing to meet the standards of advanced practice expected of a VTS. A third incorrect approach would be to make assumptions about sympathetic or parasympathetic involvement based on limited or nonspecific signs, without a thorough clinical assessment and correlation with neurological deficits. This can lead to premature or incorrect therapeutic decisions, potentially causing harm to the patient. It represents a failure to apply critical thinking and a systematic diagnostic process, which are fundamental to professional veterinary practice and the VTS credential. Professional reasoning. Professionals should approach such cases by first establishing a baseline understanding of the patient's primary neurological condition. Then, they must systematically assess for signs of autonomic dysfunction, considering both sympathetic and parasympathetic influences. This involves a thorough physical examination, vital sign monitoring, and observation of organ system functions regulated by the ANS. The VTS should then correlate these findings with the known pathophysiology of the primary neurological disease and consult with the supervising veterinarian to develop a targeted diagnostic and therapeutic plan. This structured approach ensures that all aspects of the patient's condition are addressed, leading to optimal patient outcomes and upholding the highest standards of veterinary care. Question 4. Implementation of a thorough history-taking and clinical sign assessment in a canine patient presenting with intermittent, subtle hind limb weakness. What is the most critical initial step for a veterinary technician specialist, VTS, in neurology to differentiate between a primary neurological disorder and a secondary manifestation of another systemic disease? Option A. Rely primarily on the owner's description of the weakness, assuming they have accurately identified and characterized the primary issue. Option B. Prioritize obtaining a complete blood count and serum biochemistry panel to rule out systemic metabolic causes of weakness before delving into detailed neurological history. Option C. Immediately focus on palpating the spine for any signs of discomfort or instability, assuming a spinal cord lesion is the most probable cause of the weakness. Option D. Systematically inquire about the onset, duration, progression, and any precipitating or alleviating factors of the hind limb weakness, while simultaneously observing for subtle changes in mentation, gait, and postural reactions during the initial interaction. The correct answer is D. Systematically inquire about the onset, duration, progression, and any precipitating or alleviating factors of the hind limb weakness, while simultaneously observing for subtle changes in mentation, gait, and postural reactions during the initial interaction. Explanation. This scenario is professionally challenging because the neurological signs presented are subtle and can be easily misinterpreted or attributed to less serious conditions. The veterinarian technician specialist, VTS, in neurology must possess a high level of diagnostic acumen to differentiate between primary neurological disorders and secondary manifestations of other systemic diseases. This requires a systematic approach to history-taking and clinical sign assessment, ensuring no critical information is overlooked. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic evaluation of the patient's history and clinical signs. This aligns with the ethical and regulatory obligations of a VTS to provide the highest standard of care. By meticulously gathering information about the onset, progression, and nature of the signs, and by performing a thorough neurological examination, the VTS can formulate a differential diagnosis and guide further diagnostic steps. This methodical process minimizes the risk of misdiagnosis, delayed treatment, and potential harm to the patient, upholding the principles of patient welfare and professional competence as mandated by veterinary regulatory bodies. An incorrect approach that relies solely on a cursory review of the presenting complaint without detailed historical inquiry fails to meet the standard of care. This could lead to overlooking crucial details that point towards a specific neurological etiology, potentially resulting in a delayed or incorrect diagnosis. Ethically, this constitutes a failure to act in the best interest of the patient. Another incorrect approach that focuses only on the most obvious clinical sign, neglecting other subtle neurological deficits, demonstrates a lack of thoroughness. This can lead to a skewed differential diagnosis and inappropriate diagnostic or therapeutic interventions, violating the duty of care. Furthermore, an approach that dismisses owner-reported subtle changes as insignificant without further investigation is professionally unsound. Owners are often the first to notice subtle behavioral or functional alterations, and their observations are invaluable in the diagnostic process. Ignoring these can lead to missed early signs of serious neurological disease, which is a breach of professional responsibility. The professional decision-making process for similar situations should involve a structured approach, 1. Active listening and detailed history taking, probing for onset, duration, progression, exacerbating/alleviating factors, and any associated signs. 2. Performing a systematic neurological examination, assessing mentation, cranial nerves, gait, postural reaction, spinal reflexes, and spinal palpation. 3. Correlating historical information with examination findings to generate a prioritized list of differential diagnoses. 4. Recognizing the limitations of initial findings and planning appropriate further diagnostics. 5. Continuous reassessment and refinement of the diagnostic plan based on new information. Question 5. Quality control measures reveal that a canine patient, post-craniotomy for removal of a meningioma affecting the olfactory bulbs and frontal lobe, is exhibiting subtle changes in behavior and responsiveness. The veterinary technician specialist is tasked with assessing the patient's neurological status. Considering the known lesion location, which of the following assessment strategies best reflects a thorough and clinically relevant approach to identifying potential complications or new deficits? Option A. Reevaluate the patient's response to olfactory stimuli only, as this is the most directly affected brain region. Option B. Conduct a comprehensive neurological examination, meticulously evaluating cranial nerves, especially I and Roman II, mentation and motor function, comparing findings to preoperative baselines and expected sequelae related to frontal lobe and olfactory bulb manipulation. Option C. Assume that any postoperative behavioral changes are normal recovery phenomena and monitor the patient's general comfort level. Option D. Focus primarily on the patient's ability to ambulate without stumbling and observe for any obvious head tilting, as these are common indicators of neurological compromise. The correct answer is B. Conduct a comprehensive neurological examination, meticulously evaluating cranial nerves, especially I and Roman II, mentation and motor function, comparing findings to preoperative baselines and expected sequelae related to frontal lobe and olfactory bulb manipulation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to interpret subtle neurological signs in a patient with a known brain lesion. The challenge lies in differentiating between expected postoperative sequelae and signs indicative of a new or worsening neurological deficit, which could necessitate urgent intervention. Accurate assessment is critical for patient welfare and effective communication with the veterinary neurologist. Correct approach analysis. The correct approach involves a systematic and thorough neurological examination, focusing on specific cranial nerves and brain regions known to be affected by the lesion's location. This approach aligns with best professional practice by prioritizing patient safety and evidence-based assessment. By comparing current findings to preoperative baselines and understanding the expected functional deficits associated with the specific brain structure involved, the technician can accurately identify any deviations. This methodical process ensures that any changes are noted and communicated promptly to the veterinary neurologist, allowing for timely and appropriate management decisions, thereby upholding the ethical obligation to provide competent care. Incorrect approaches analysis. One incorrect approach involves relying solely on the patient's general demeanor and mobility. This is professionally unacceptable, as it overlooks specific neurological deficits that may not be immediately apparent in overall behavior. It fails to meet the standard of care for a neurological patient, potentially delaying the identification of critical changes. This approach also risks misinterpreting subtle signs as normal recovery, which could lead to a breach of the duty of care. Another incorrect approach is to assume all postoperative changes are normal sequelae without further investigation. This is a failure of due diligence and professional responsibility. It neglects the possibility of complications such as hemorrhage, edema, or infection, which require immediate attention. Such an assumption can lead to significant patient harm and constitutes a failure to adhere to the expected standards of veterinary neurological care. A further incorrect approach is to focus only on the most obvious neurological deficits, such as ataxia, while ignoring less apparent but equally important signs like pupillary light response abnormalities or changes in mentation. This selective examination is insufficient for a comprehensive neurological assessment and can lead to misdiagnosis or delayed treatment of serious conditions. It demonstrates a lack of thoroughness and a failure to apply comprehensive knowledge of brain structure and function to patient assessment. Professional reasoning. Professionals should approach such situations by first reviewing the patient's history, including the location and nature of the brain lesion and the surgical procedure performed. This is followed by a detailed, systematic neurological examination, paying close attention to cranial nerves, motor function, proprioception, mentation, and behavior. Any findings should be compared to preoperative assessments and expected postoperative outcomes. Open and clear communication with the supervising veterinarian is paramount, providing objective, detailed observations to facilitate informed decision-making. This structured approach ensures that patient welfare is prioritized and that care is delivered in accordance with established professional standards. Question 6. The assessment process reveals a canine patient exhibiting progressive ataxia, nystagmus, and neck pain. Based on these clinical signs, meningeal inflammation is suspected. Which of the following approaches best mitigates the risks associated with further diagnostic evaluation of the meninges and cerebrospinal fluid, CSF? Option A. Administering a broad-spectrum antibiotic and anti-inflammatory medication immediately, and proceeding with CSF collection once the patient appears more comfortable. Option B. Conducting a thorough neurological examination, assessing for signs of increased intracranial pressure, reviewing coagulation parameters, and consulting imaging findings before planning any invasive CSF collection. Option C. Recommending immediate euthanasia due to the severity of the neurological signs and the inherent risks of CSF collection. Option D. Performing a rapid, blind lumbar puncture to obtain CSF for analysis, prioritizing speed due to the patient's discomfort. The correct answer is D. Performing a rapid, blind lumbar puncture to obtain CSF for analysis, prioritizing speed due to the patient's discomfort. Explanation. The assessment process reveals a patient presenting with neurological signs suggestive of meningeal inflammation. This scenario is professionally challenging because accurate risk assessment regarding the meninges and cerebrospinal fluid, CSF, is paramount for guiding diagnostic and therapeutic interventions. Misinterpreting findings or failing to consider potential complications can lead to delayed diagnosis, inappropriate treatment, and adverse patient outcomes, including iatrogenic injury during CSF collection. The correct approach emphasizes a thorough understanding of the anatomical layers of the meninges and the physiological role of CSF, coupled with a meticulous risk assessment prior to any invasive procedures. This involves evaluating the patient's overall stability, identifying contraindications for CSF collection, e.g., increased intracranial pressure, coagulopathy, and selecting the safest and most appropriate collection site and technique. This aligns with the VTS Neurology's responsibility to provide advanced technical and diagnostic support, ensuring patient safety and adherence to established veterinary medical protocols, which implicitly require risk mitigation. Best professional practice dictates a proactive, evidence-based approach to patient care, prioritizing safety and efficacy. An incorrect approach would be to proceed with CSF collection without a comprehensive risk assessment. This could involve overlooking subtle signs of increased intracranial pressure, which can lead to brain herniation during lumbar puncture, a life-threatening complication. Another failure would be to disregard the patient's clotting status, increasing the risk of hemorrhage within the meningeal spaces. Furthermore, selecting an inappropriate collection site without considering anatomical landmarks or potential for nerve damage constitutes a significant deviation from best practice. These failures represent regulatory and ethical breaches by neglecting the duty of care, failing to uphold the standards of veterinary practice, and potentially causing harm to the patient, which is contrary to the core principles of veterinary medicine and the VTS certification's emphasis on advanced patient management. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's history, physical examination findings, especially neurological deficits and signs of increased intracranial pressure, and diagnostic imaging results. This information should be synthesized to identify potential risks associated with diagnostic procedures. A critical step is to consult relevant literature and establish protocols for CSF analysis and meningeal disease. If any contraindications are identified, alternative diagnostic strategies should be considered or the procedure deferred until the patient is stabilized. Open communication with the supervising veterinarian regarding identified risks and proposed management plans is essential. Question 7. Benchmark analysis indicates that a veterinary technician specialist in neurology must possess a robust understanding of diagnostic workflows. When presented with a canine patient exhibiting progressive ataxia and apparent visual deficits, which of the following approaches to the cranial nerve examination would be considered the most diagnostically sound and professionally responsible initial step? Option A. Prioritize subjective observations of the patient's behavior and gait, deferring detailed cranial nerve testing until after initial stabilization. Option B. Begin by assessing the menace response and pupillary light reflexes, as these are often indicative of significant forebrain or optic pathway involvement. Option C. Conduct a complete and systematic examination of all 12 cranial nerves in a predetermined order, starting with cranial nerves I olfactory and Roman II optic. Option D. Randomly test various cranial nerves, focusing on those that appear most obviously affected based on initial observation. The correct answer is B. Begin by assessing the menace response and pupillary light reflexes, as these are often indicative of significant forebrain or optic pathway involvement. Explanation. Scenario analysis. This scenario presents a challenge in a neurology VTS exam context by requiring the technician to prioritize diagnostic steps for a patient with suspected neurological deficits. The difficulty lies in identifying the most critical initial assessment for a cranial nerve examination, considering the potential for rapid deterioration and the need for efficient, targeted evaluation. The VTS candidate must demonstrate a nuanced understanding of cranial nerve function and its clinical implications in a diagnostic workflow. Correct approach analysis. The correct approach involves systematically assessing cranial nerves based on their anatomical location and functional pathways, starting with those most accessible and indicative of significant neurological compromise. This aligns with best professional practice by prioritizing patient safety and diagnostic efficiency. A thorough cranial nerve examination, when performed systematically, allows for localization of lesions within the central or peripheral nervous system. This methodical approach is implicitly supported by general veterinary practice guidelines that emphasize thoroughness and accuracy in diagnostic procedures, ensuring that no critical findings are overlooked. Ethical considerations also mandate a comprehensive evaluation to provide the best possible care. Incorrect approaches analysis. One incorrect approach would be to randomly assess cranial nerves without a structured order. This fails to meet the standard of care expected of a VTS candidate, as it increases the risk of missing subtle deficits or misinterpreting findings due to a lack of systematic comparison. It demonstrates a lack of understanding of the interconnectedness of cranial nerve functions and their diagnostic significance. Another incorrect approach would be to focus solely on a few commonly affected cranial nerves without a complete examination. This is professionally unacceptable, as it can lead to a false sense of security or a misdiagnosis, potentially delaying appropriate treatment. It violates the ethical obligation to provide thorough and complete diagnostic services. A third incorrect approach might involve prioritizing subjective observations over objective cranial nerve testing. While subjective observations are important, they must be substantiated by objective findings. Relying solely on subjective impressions without a structured cranial nerve exam would be a failure to adhere to established diagnostic protocols and could lead to misdiagnosis. Professional reasoning. Professionals should approach cranial nerve examinations with a structured, systematic methodology. This involves understanding the anatomical course and function of each cranial nerve and developing a consistent order for assessment. When faced with a patient exhibiting potential neurological signs, the decision-making process should involve 1. Initial stabilization and assessment of vital signs. 2. A systematic cranial nerve examination, starting with observation of facial symmetry and eye movements, progressing through pupillary light reflexes, menace response, palpebral reflexes, and then more detailed assessments of other cranial nerves. 3. Correlating findings with the patient's history and other neurological deficits. 4. Formulating a differential diagnosis based on the localization of the lesion. This systematic approach ensures comprehensive evaluation and accurate diagnosis. Question 8. Investigation of a newly presented canine patient with progressive ataxia and proprioceptive deficits requires the veterinary technician specialist in neurology to assess the potential anatomical basis of the lesion. considering the significant differences in cranial vault structure and the relative size and location of the cerebellum between canids and felids, which approach best mitigates the risk of misinterpreting diagnostic imaging findings. Option A, emphasizing the interpretation of magnetic resonance imaging, MRI sequences over anatomical landmarks, assuming advanced imaging modalities inherently compensate for anatomical discrepancies. Option B, prioritizing interpretation based on generalized mammalian neuroanatomy, assuming common underlying principles across common domestic species. Option C, relying primarily on the clinical signs presented, without significant emphasis on detailed comparative anatomical review, as the neurological deficits are the most direct indicators of pathology. Option D, focusing on the known species-specific anatomical variations of the canine central nervous system, including the typical appearance and relationships of the cerebellum, brainstem, and cerebrum, to localize the lesion. Correct answer is B, prioritizing interpretation based on generalized mammalian neuroanatomy, assuming common underlying principles across common domestic species. Explanation: this scenario is professionally challenging due to the inherent variability in neurological conditions and the need for precise anatomical understanding to guide diagnostic and therapeutic interventions. A veterinary technician specialist in neurology must possess a deep understanding of comparative neuroanatomy to accurately interpret imaging findings, anticipate potential complications, and communicate effectively with the supervising veterinarian. The risk assessment here lies in identifying the most appropriate approach to evaluating a neurological deficit, considering the potential for misinterpretation due to species-specific anatomical differences. The correct approach represents best professional practice because it prioritizes a systematic, species-specific anatomical evaluation. This aligns with the core principles of veterinary medicine, which mandate providing care tailored to the individual patient and species. By focusing on the known anatomical variations between species, the technician can more accurately localize the lesion, anticipate potential diagnostic challenges, e.g., differences in skull thickness affecting imaging penetration, variations in ventricular size, or the presence of specific anatomical landmarks, and contribute more effectively to the diagnostic process. This approach minimizes the risk of misdiagnosis or inappropriate treatment planning, thereby upholding the standard of care expected of a VTS. An incorrect approach that relies solely on generalized anatomical knowledge without considering species-specific variations poses significant regulatory and ethical risks. It could lead to misinterpretation of diagnostic imaging, such as mistaking a normal anatomical variant in one species for pathology in another, or failing to recognize a critical anatomical structure due to its altered position or size. This directly violates the ethical obligation to provide competent and knowledgeable care. From a regulatory standpoint, practicing outside the scope of one's expertise or failing to adhere to established standards of practice can result in disciplinary action, including censure, suspension, or revocation of credentials. Furthermore, such an approach increases the risk of patient harm, which is a fundamental ethical and legal concern. The professional reasoning process for similar situations should involve a thorough review of the patient's signalment, including species, breed, and age, as these factors can influence neurological presentation and anatomical considerations. A technician should then access and critically evaluate species-specific anatomical resources, such as atlases, textbooks, and peer-reviewed literature, to inform their interpretation of clinical signs and diagnostic data. Collaboration with the supervising veterinarian, clearly articulating anatomical concerns and potential differential diagnoses based on comparative anatomy, is crucial. This iterative process of information gathering, critical analysis, and communication ensures that diagnostic and therapeutic decisions are based on the most accurate and relevant anatomical understanding. Question 9. What factors determine the most appropriate interpretation of central nervous system, CNS, diagnostic imaging findings in a veterinary patient presenting with neurological deficits? Option A, relying solely on the patients presenting clinical signs to guide the interpretation of imaging without a detailed independent review of the images. Option B, accepting the initial interpretation provided by an automated image analysis software without further critical evaluation. Option C, prioritizing the most visually striking abnormalities identified on a single imaging plane, assuming they directly explain the presenting clinical signs. Option D. A comprehensive review of all imaging sequences, correlation with the patient's clinical signs and history, and consideration of differential diagnoses based on the observed abnormalities. The correct answer is D. A comprehensive review of all imaging sequences, correlation with the patient's clinical signs and history, and consideration of differential diagnoses based on the observed abnormalities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist, VTS, in neurology to make critical decisions regarding the interpretation of diagnostic imaging findings in a patient with suspected central nervous system, CNS, disease. The complexity arises from the potential for subtle abnormalities, the need to correlate imaging with clinical signs, and the responsibility to communicate these findings accurately to the veterinarian for treatment planning. Misinterpretation can lead to delayed or incorrect diagnoses, impacting patient outcomes and potentially leading to adverse events. VTS must navigate the inherent limitations of imaging modalities and the subjective nature of interpretation, while adhering to established diagnostic protocols and ethical standards. Correct approach analysis. The correct approach represents best professional practice because it emphasizes a systematic and evidence-based evaluation of diagnostic imaging. This involves a thorough review of all available imaging sequences, meticulous attention to detail in identifying any deviations from normal anatomy, and a critical assessment of the significance of any identified abnormalities in the context of the patient's clinical presentation. This approach aligns with the VTS's role in providing specialized technical support and contributing to diagnostic accuracy. It upholds the ethical obligation to provide competent care and to act in the best interest of the animal patient, as mandated by veterinary professional guidelines that stress the importance of accurate data collection and interpretation in patient management. Incorrect approaches analysis. Focusing solely on the most obvious or dramatic findings without a comprehensive review of all imaging planes and sequences is an ethical failure. This can lead to overlooking subtle but clinically significant lesions, such as early inflammatory changes or small neoplastic infiltrations, thereby compromising diagnostic accuracy and potentially delaying appropriate treatment. Relying exclusively on the patient's presenting clinical signs to interpret imaging findings, without a thorough independent assessment of the images themselves, is also an ethical failure. While clinical correlation is vital, it should not substitute for a detailed imaging interpretation. This approach risks misattributing clinical signs to imaging findings that are not actually present or are misinterpreted, leading to diagnostic errors. Over-reliance on automated or AI-driven interpretation tools without independent VTS oversight is a regulatory and ethical concern. While these tools can be supportive, they are not a replacement for skilled professional judgment and may miss nuanced findings or generate false positives/negatives. The VTS has a professional responsibility to validate and critically assess all diagnostic data, including AI-generated reports, to ensure patient safety and accurate diagnosis. Professional reasoning. Professionals should approach diagnostic imaging interpretation with a structured methodology. This involves first understanding the patient's signalment and clinical history, then systematically reviewing all imaging sequences, paying close attention to anatomical landmarks and potential abnormalities. The next step is to correlate any identified imaging findings with the clinical signs, considering differential diagnoses. Finally, the VTS should clearly and accurately document their findings and communicate them to the veterinarian, highlighting any areas of concern or uncertainty. This process ensures a thorough, accurate, and ethically sound diagnostic contribution. Question 10. When evaluating a canine patient presenting with progressive pelvic limb weakness and ataxia, which of the following approaches to localizing the lesion within the spinal cord demonstrates the most precise application of spinal cord anatomical knowledge for guiding diagnostic efforts? Option A. Focusing on the presence of pain on palpation of the thoracolumbar region and inferring a generalized spinal cord insult without further anatomical refinement. Option B. Identifying the most severely affected limb and assuming the lesion is located contralaterally at the spinal cord level corresponding to the brachial plexus. Option C. Differentiating between upper and lower motor neuron signs in the pelvic limbs and correlating these findings with the known segmental innervation of the spinal cord from the lumbosacral intumescence to the thoracic spine. Option D. Observing the presence of proprioceptive deficits and assuming a lesion within the cerebellum without considering the spinal cord's role in ascending sensory tracts. The correct answer is B. Identifying the most severely affected limb and assuming the lesion is located contralaterally at the spinal cord level corresponding to the brachial plexus. Explanation: this scenario presents a professional challenge due to the critical nature of spinal cord anatomy in neurological diagnostics and the potential for misinterpretation leading to delayed or incorrect treatment. A veterinary technician specialist in neurology must possess a nuanced understanding of the spinal cord's segmental innervation, vascular supply, and susceptibility to injury at specific levels. The challenge lies in correlating clinical signs with precise anatomical locations to guide diagnostic imaging and therapeutic interventions effectively. The correct approach represents best professional practice because it demonstrates a thorough understanding of spinal cord anatomy and its functional implications. By accurately identifying the likely anatomical origin of the neurological deficits based on the distribution of signs, the technician specialist facilitates targeted diagnostic procedures. This precision minimizes unnecessary interventions, reduces patient stress, and optimizes the diagnostic yield, aligning with the ethical imperative to provide competent and efficient patient care as mandated by veterinary professional standards and guidelines for advanced practice. An incorrect approach that relies on generalized assumptions about spinal cord lesions without precise anatomical correlation is professionally unacceptable. This failure to apply specific anatomical knowledge can lead to misdiagnosis, delayed treatment, and potentially irreversible neurological damage. Such an approach violates the professional duty of care by not utilizing the advanced knowledge expected of a VTS and could be considered a breach of professional conduct if it results in substandard patient care. Another incorrect approach that focuses solely on gross motor deficits without considering sensory pathways or specific dermatomes/myotomes is also flawed. This oversight neglects the intricate functional anatomy of the spinal cord, leading to an incomplete assessment. The professional reasoning process should involve a systematic evaluation of all neurological deficits, correlating them with known anatomical pathways and segmental innervation of the spinal cord. This systematic approach, grounded in detailed anatomical knowledge, allows for the formulation of accurate differential diagnoses and the development of an appropriate diagnostic and therapeutic plan. Question 11. Stakeholder feedback indicates that veterinary technicians specializing in neurology often encounter scenarios where a patient presents with a combination of ataxia, intention tremors, and a wide base stance, with no apparent cranial nerve deficits. Based on this clinical presentation, which specific neuroanatomical region is most likely affected? Option A. Vestibular apparatus within the inner ear. Option B. Spinal cord dorsal columns. Option C. Cerebral cortex. Option D. Cerebellum and its associated pathways. Correct answer is D. Cerebellum and its associated pathways. Explanation: scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to accurately identify a lesion based on neurological signs and then correlate that with specific neuroanatomical structures. Misidentification of the lesion location can lead to incorrect treatment plans, delayed or misdiagnosis, and potentially adverse patient outcomes. The VTS must demonstrate a deep understanding of how different parts of the nervous system control specific functions and how damage to these areas manifests clinically. This requires not just memorization, but the ability to apply neuroanatomical knowledge to a clinical presentation. Correct approach analysis. The correct approach involves a systematic evaluation of the presented clinical signs and their known neuroanatomical correlates. By recognizing that the patient exhibits signs indicative of damage to the cerebellum and vestibular system, and then identifying the specific anatomical structures within these regions, e.g., cerebellar peduncles, flocculonodular lobe, the VTS can pinpoint the most likely location of the lesion. This aligns with the VTS neurology exam's emphasis on applying neuroanatomical knowledge to clinical scenarios, ensuring patient safety and optimal care through accurate diagnosis and treatment planning, which is a core ethical and professional responsibility. Incorrect approach is analysis. One incorrect approach would be to focus solely on the presenting symptoms without a strong neuroanatomical correlation. For example, if the signs are ataxia and head tilt, but the VTS incorrectly attributes these to a cerebral lesion without considering the cerebellum or vestibular system. This demonstrates a failure to apply fundamental neuroanatomical principles. This is a regulatory failure, as it deviates from the expected standard of care for a VTS neurology specialist, potentially leading to misdiagnosis and inappropriate treatment. Ethically, it compromises patient welfare by not utilizing the highest level of knowledge and skill. Another incorrect approach would be to oversimplify the diagnosis by attributing the signs to a general area without specifying the precise anatomical structures involved. For instance, stating the lesion is in the brainstem without further localization within the brainstem, e.g., pons, medulla, or specific nuclei would be insufficient. This lacks the specificity required of a VTS neurology specialist and fails to meet the diagnostic rigor expected by regulatory bodies overseeing specialist practice. It also fails to provide the detailed information necessary for effective treatment planning. A third incorrect approach would be to rely on a generalized understanding of neurological disease without specific neuroanatomical localization. For example, suggesting a neurological disorder without attempting to localize the lesion to a specific anatomical region or structure. This demonstrates a significant gap in the application of neuroanatomical knowledge, which is a cornerstone of VTS neurology practice. It is a failure to meet the professional standards and ethical obligations to provide specialized neurological care. Professional reasoning. Professionals should approach such cases by first meticulously gathering all clinical information, including the onset, progression, and specific nature of the neurological signs. This information should then be systematically mapped onto a detailed understanding of neuroanatomy, considering the functional roles of different brain regions and pathways. Differential diagnoses should be generated based on this localization, and further diagnostic steps, imaging, CSF analysis, etc., should be guided by the suspected anatomical location. This structured approach ensures that all relevant information is considered, leading to the most accurate and efficient diagnostic process, thereby upholding professional standards and ethical obligations to the patient. Question 12. Stakeholder feedback indicates a need for improved clarity in the interpretation of complex neurological radiographic findings. A veterinary technician specialist, VTS, in neurology is presented with a series of thoracic radiographs taken as part of a pre-anesthetic workup for a dog undergoing spinal surgery. The radiographs reveal a small, incidental pulmonary nodule. How should the VTS approach the interpretation of this finding in the context of the patient's primary neurological condition and upcoming surgery? Option A. Interpret the pulmonary nodule as definitively metastatic disease without further investigation, recommending immediate cessation of the planned spinal surgery. Option B. Systematically evaluate the entire thoracic radiographic study. Characterize the pulmonary nodule based on size, location, and margins, and document its incidental nature relative to the primary neurological diagnosis and surgical plan, recommending follow-up as per standard veterinary guidelines for incidental pulmonary findings. Option C. Immediately report the pulmonary nodule as a potential complication of the upcoming surgery, advising postponement until further thoracic imaging and diagnostics are performed. Option D. Focus solely on the spinal column and surrounding structures, disregarding the pulmonary nodule as irrelevant to the neurological case. The correct answer is B. Systematically evaluate the entire thoracic radiographic study, characterize the pulmonary nodule based on size, location, and margins, and document its incidental nature relative to the primary neurological diagnosis and surgical plan, recommending follow-up as per standard veterinary guidelines for incidental pulmonary findings. Explanation. Scenario analysis. This scenario is professionally challenging because interpreting radiographic findings in neurology requires a high degree of specialized knowledge and the ability to integrate subtle visual cues with clinical signs. Misinterpretation can lead to delayed or incorrect diagnoses, impacting patient outcomes and potentially leading to unnecessary treatments or missed critical interventions. The VTS neurology specialist is expected to provide a definitive interpretation that guides further diagnostic and therapeutic decisions, making accuracy paramount. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the radiographic images, correlating findings with the patient's neurological presentation. This aligns with the VTS neurology scope of practice, which emphasizes advanced diagnostic interpretation. Best professional practice dictates that the specialist's interpretation should be based on established veterinary neurological principles and radiographic interpretation guidelines, ensuring that all relevant structures are assessed and potential abnormalities are identified and characterized. This adheres to the ethical obligation to provide competent care and the regulatory expectation that VTS specialists possess and apply advanced knowledge. Incorrect approaches analysis. One incorrect approach involves solely focusing on gross abnormalities and overlooking subtle changes. This fails to meet the standard of care expected of a specialist and could lead to misdiagnoses of early-stage or less obvious neurological conditions, violating the duty of care and potentially the regulatory standards for specialist practice. Another incorrect approach is to interpret findings without considering the patient's clinical history and neurological deficits. Radiographic findings are only one piece of the diagnostic puzzle. Failing to integrate this information means the interpretation may be incomplete or misleading, potentially leading to inappropriate treatment plans and violating the principle of holistic patient care. This also falls short of the advanced diagnostic reasoning expected of a VTS. A third incorrect approach is to rely on generalized radiographic interpretation principles without applying specific neurological considerations. While general radiology knowledge is foundational, neurological imaging requires a nuanced understanding of specific anatomical structures, common neurological pathologies, and their radiographic manifestations. A non-neurologically specific interpretation may miss critical details or mischaracterize findings relevant to neurological disease, thus failing to meet the specialized competence required by the VTS neurology credential. Professional reasoning. Professionals should approach radiographic interpretation by first establishing a systematic review process for the images, ensuring all relevant anatomical regions are examined. This should be followed by a thorough correlation with the patient's signalment, history, and neurological examination findings. Any discrepancies or uncertainties should prompt further investigation or consultation. The VTS specialist's role is to provide an expert opinion that synthesizes all available data to formulate a differential diagnosis and recommend further diagnostic or therapeutic steps, always prioritizing patient welfare and adhering to the highest standards of professional conduct and regulatory expectations for their specialty. Question 13. Compliance review shows a veterinary technician specialist in neurology is consulting on a case involving a 7-year-old Labrador retriever presenting with acute onset of ataxia and proprioceptive deficits in all 4 limbs. The attending veterinarian is considering diagnostic imaging. Which of the following approaches best reflects the appropriate indications for skull and spinal radiographs in this scenario, adhering to VTS neurology standards? Option A. Suggest that skull and spinal radiographs are not immediately necessary and recommend a trial of conservative medical management, deferring imaging until the patient fails to respond. Option B. Recommend skull and spinal radiographs due to the presence of acute ataxia and proprioceptive deficits, as these signs strongly suggest potential intracranial or spinal pathology requiring visualization. Option C. Recommend skull and spinal radiographs only if the client expresses concern about the severity of the neurological signs and explicitly requests advanced imaging. Option D. Recommend skull and spinal radiographs for any patient exhibiting any neurological sign, regardless of the specific signs or their impact on the patient's quality of life, to ensure all possibilities are explored. The correct answer is B. Recommend skull and spinal radiographs due to the presence of acute ataxia and proprioceptive deficits, as these signs strongly suggest potential intracranial or spinal pathology requiring visualization. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary neurology, where the decision to pursue advanced diagnostics like skull and spinal radiographs is influenced by multiple factors, including client financial constraints, the perceived urgency of the neurological signs, and the technician's role in advocating for appropriate diagnostic pathways. The challenge lies in balancing the need for definitive diagnosis with practical limitations, ensuring that the technician's recommendations are ethically sound, legally compliant with VTS neurology standards, and ultimately beneficial to the patient. The VTS neurology is expected to possess a deep understanding of diagnostic indications and to effectively communicate these to the veterinary team and clients. Correct approach analysis. The correct approach prioritizes a thorough neurological assessment and considers the specific clinical signs and their progression to determine the most appropriate diagnostic imaging. This aligns with the VTS neurology's role in providing expert-level patient care and diagnostic support. Regulatory frameworks for VTS neurology emphasize evidence-based practice and the application of advanced knowledge to patient management, recommending skull and spinal radiographs when there is a high index of suspicion for intracranial or spinal pathology based on objective neurological findings, is a direct application of this expertise. This approach ensures that diagnostic efforts are focused and efficient, leading to a timely and accurate diagnosis, which is ethically mandated for patient welfare and professionally expected of a VTS. Incorrect approaches analysis, recommending skull and spinal radiograph solely based on the presence of any neurological sign, without further differentiation or assessment of severity, is an overreach and potentially wasteful of resources. This fails to demonstrate the nuanced diagnostic reasoning expected of a VTS neurology, potentially leading to unnecessary procedures and costs for the client, which could be seen as a failure in professional responsibility and client stewardship. Recommending skull and spinal radiographs only when the client explicitly requests them, irrespective of the clinical findings, abdicates the VTS neurology's professional responsibility to guide diagnostic decisions. This approach prioritizes client demand over clinical necessity and expert judgment, which is a deviation from best practices and ethical standards that require the VTS to act in the patient's best interest. Suggesting that skull and spinal radiographs are always indicated for any patient exhibiting neurological signs, regardless of the specific signs or their impact on the patient's quality of life, demonstrates a lack of critical thinking and an inability to tailor diagnostic plans. This approach is not aligned with the principles of prudent diagnostic workups and could lead to unnecessary patient stress and financial burden without clear clinical benefit, violating the VTS's obligation to provide judicious and evidence-based care. Professional reasoning. Professionals should approach diagnostic imaging decisions by first conducting a comprehensive neurological examination to localize the lesion. This is followed by a thorough assessment of the patient's history, the nature and progression of clinical signs, and the potential differential diagnoses. The VTS neurology should then consider the diagnostic yield of various imaging modalities in relation to these findings and the potential impact on patient prognosis and treatment options. Client financial constraints and owner preferences should be discussed transparently, but the primary recommendation for diagnostic imaging should always be driven by clinical necessity and the potential to achieve a definitive diagnosis that will guide patient care in accordance with VTS neurology standards and ethical guidelines. Question 14. Quality control measures reveal subtle, inconsistent hind limb ataxia during routine ambulation assessments of a postoperative spinal surgery patient. As a veterinary technician specialist, VTS, in neurology, what is the most appropriate next step to ensure optimal patient care and diagnostic accuracy? Option A. Advise the owner that minor ataxia is common after spinal surgery and that the patient will likely improve with time, without further immediate investigation. Option B. Immediately recommend advanced imaging such as a repeat MRI to rule out any new spinal cord compression or complications, bypassing further clinical assessment. Option C. Conduct a detailed, systematic reevaluation of the patient's gait, meticulously documenting specific abnormalities, e.g., hypermetria, dysmetria, circumduction, knuckling, and correlating these findings with the patient's known neurological deficits and surgical site. Option D. Document the observed ataxia in the patient's record as a minor observation and proceed with routine postoperative care as scheduled, assuming it is a transient post-anesthetic effect. The correct answer is C. Conduct a detailed, systematic reevaluation of the patient's gait, meticulously documenting specific abnormalities, e.g., hypermetria, dysmetria, circumduction, knuckling, and correlating these findings with the patient's known neurological deficits and surgical site. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the veterinary technician specialist, VTS, in neurology to interpret subtle gait abnormalities observed during a quality control review. The challenge lies in accurately identifying the underlying neurological cause and recommending appropriate diagnostic or therapeutic interventions based on these observations, while adhering to the strict standards of practice expected of a VTS. The quality control measures highlight the importance of consistent and accurate patient assessment, which directly impacts patient care and outcomes. Correct approach analysis. The correct approach involves a systematic and thorough reevaluation of the patient's gait, correlating the observed abnormalities with known neurological deficits, and considering the patient's history and previous diagnostic findings. This aligns with the VTS Neurology certification's emphasis on advanced diagnostic interpretation and problem-solving within the neurological domain. Best professional practice dictates that a VTS should leverage their specialized knowledge to identify subtle or evolving neurological signs that might be missed by less experienced personnel. This approach ensures that the patient receives the most accurate and timely diagnosis and treatment plan, upholding the ethical obligation to provide high-quality care and acting within the scope of practice as defined by veterinary regulatory bodies. Incorrect approaches analysis. One incorrect approach would be to dismiss the observed gait abnormalities as minor or transient without further investigation. This fails to meet the professional standard of care expected of a VTS, as it neglects potential early signs of neurological deterioration or misdiagnosis. Ethically, this constitutes a failure to act in the best interest of the patient and could be considered a breach of professional responsibility. Another incorrect approach would be to immediately recommend invasive diagnostic procedures without a thorough reassessment and correlation of the gait findings with the patient's overall neurological status. This could lead to unnecessary stress, risk, and cost for the patient and owner, and demonstrates a lack of nuanced diagnostic reasoning. It may also overstep the VTS's role if such recommendations are made without direct veterinary supervision or a clear diagnostic pathway. A third incorrect approach would be to rely solely on the initial assessment without considering potential changes or new information. Veterinary neurology is dynamic, and gait can be a sensitive indicator of neurological function. Failing to reevaluate and adapt the diagnostic or therapeutic plan based on new observations is a failure of continuous patient assessment and a deviation from best practices in managing neurological conditions. Professional reasoning. When faced with quality control findings related to gait analysis, a VTS in neurology should employ a structured decision-making process. This begins with acknowledging the quality control finding and its potential implications. The next step is to conduct a comprehensive reevaluation of the patient's gait, utilizing established neurological examination techniques. This reevaluation should be followed by a critical analysis, correlating the observed gait deficits with the patient's known neurological condition, history, and any prior diagnostic results. Based on this analysis, the VTS should formulate a differential diagnosis for the gait abnormality. In consultation with the veterinarian, propose further diagnostic steps or therapeutic adjustments. This systematic approach ensures that patient care is evidence-based, ethically sound, and aligned with the advanced expertise expected of a VTS. Question 15. Process analysis reveals a canine patient presenting with progressive hind limb weakness, characterized by inability to bear weight and a noticeable decrease in muscle mass in the affected limbs. During the neurological examination, the patellar reflex is significantly diminished, and the withdrawal reflex is absent in the hind paws. Muscle tone in the hind limbs appears reduced, and proprioceptive positioning is impaired. Based on these findings, which of the following anatomical and physiological assessments is most critical for accurate lesion localization? Option A. Differentiating between upper and lower motor neuron signs by evaluating reflex activity, muscle tone, and proprioception in the hind limbs. Option B. Assessing the patient's overall cardiovascular status and respiratory rate to rule out systemic causes of weakness. Option C. Measuring the patient's body temperature and hydration status to identify potential metabolic derangements. Option D. Evaluating cranial nerve function and ocular movements to assess for brainstem involvement. The correct answer is A. differentiating between upper and lower motor neuron signs by evaluating reflex activity, muscle tone, and proprioception in the hind limbs. Explanation: scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to interpret subtle neurological signs in a patient presenting with a potential spinal cord injury. Differentiating between upper and lower motor neuron signs is critical for accurate localization of the lesion, which directly impacts treatment planning and prognosis. Misinterpretation can lead to delayed or inappropriate interventions, negatively affecting patient outcomes and potentially violating standards of care. Correct approach analysis. The correct approach involves a systematic neurological examination focusing on reflexes, muscle tone, and proprioception in the affected limbs. This methodical assessment allows for the precise identification of deficits consistent with a lower motor neuron lesion, characterized by flaccid paralysis, decreased or absent reflexes, and muscle atrophy. This aligns with the VTS Neurology's role in providing advanced diagnostic support and contributing to evidence-based treatment strategies, upholding the highest standards of patient care as expected within the veterinary profession. Incorrect approach is analysis. One incorrect approach would be to solely rely on the presence of paresis without further detailed examination. This fails to differentiate between upper and lower motor neuron involvement, leading to a potentially inaccurate diagnosis and treatment plan. Ethically, this represents a failure to provide competent care by not performing a thorough diagnostic workup. Another incorrect approach would be to immediately recommend aggressive surgical intervention based on a presumptive diagnosis without definitive localization. This disregards the need for precise anatomical localization, which is a cornerstone of neurological diagnostics. It could lead to unnecessary procedures, increased patient risk, and financial burden on the owner, potentially violating principles of beneficence and non-maleficence. A third incorrect approach would be to attribute the deficits to generalized weakness without considering specific neurological pathways. This demonstrates a lack of specialized knowledge expected of a VTS and fails to identify the underlying cause, hindering effective management. This constitutes a failure to meet the professional standards of a VTS. Professional reasoning. Professionals should approach such cases by first recalling the fundamental principles of neuroanatomy and neurophysiology. They must then systematically apply these principles through a comprehensive neurological examination, meticulously documenting findings. The decision-making process should involve correlating clinical signs with anatomical structures and physiological functions to localize the lesion. This structured approach, grounded in scientific knowledge and ethical considerations, ensures accurate diagnosis, appropriate treatment recommendations, and optimal patient outcomes, thereby fulfilling professional responsibilities. Question 16. System analysis indicates that a 7-year-old Labrador Retriever presents with progressive hind limb ataxia and occasional stumbling. As a veterinary technician specialist in neurology, you are tasked with assessing the patient's proprioception. Which of the following approaches best reflects the systematic and objective methodology required for this assessment? Option A. Conduct a brief observation of the dog walking across the examination room and note any visible signs of incoordination. Option B. Perform a thorough neurological examination, including placing the limbs in abnormal positions, e.g., knuckling, hopping, and assessing postural reactions like the placing reaction and wheelbarrowing, while observing the speed and quality of the animal's correction. Option C. Rely on the owner's description of the dog's gait abnormalities and assume the ataxia is indicative of a proprioceptive deficit. Option D. Immediately conclude that the hind limb ataxia is due to a spinal cord lesion, affecting proprioceptive pathways without further specific testing. The correct answer is B. Perform a thorough neurological examination, including placing the limbs in abnormal positions, e.g., knuckling, hopping, and assessing postural reactions like the placing reaction and wheelbarrowing, while observing the speed and quality of the animal's correction. Explanation. Scenario analysis. Assessing proprioception in a neurologically compromised canine patient presents a significant challenge due to the inherent subjectivity of the assessment and the potential for confounding factors. The veterinarian technician specialist, VTS, must differentiate true proprioceptive deficits from other neurological or orthopedic issues that might mimic them. Furthermore, the patient's overall condition, including pain, anxiety, or concurrent diseases, can influence the reliability of the assessment, demanding a nuanced and systematic approach. The VTS must also consider the ethical imperative to provide accurate diagnostic information to guide treatment decisions, ensuring the patient receives appropriate care. Correct approach analysis. The correct approach involves a systematic and objective evaluation of proprioception, utilizing established neurological examination techniques. This includes placing the limb in abnormal positions, knuckling, hopping, wheelbarrowing, and observing the speed and quality of the patient's correction. The VTS should also assess postural reactions, such as the hemi-walking test and the placing reaction, to further elucidate proprioceptive pathways. This methodical approach aligns with the VTS Neurology certification standards, which emphasize the application of advanced diagnostic techniques and the accurate interpretation of neurological findings. By adhering to these standardized protocols, the VTS ensures the reliability and reproducibility of the assessment, providing crucial data for diagnosis and treatment planning, thereby upholding the ethical obligation to provide competent care. Incorrect approaches analysis. One incorrect approach involves relying solely on the owner's subjective report of the animal's gait abnormalities without performing a direct neurological assessment. This fails to meet the VTS Neurology standard of care, as it bypasses objective diagnostic procedures and could lead to misdiagnosis. Ethically, this constitutes a failure to provide competent veterinary care, as it relies on potentially inaccurate anecdotal evidence rather than professional expertise. Another incorrect approach is to perform a cursory assessment, such as only observing the animal walk across the room, without specific proprioceptive testing. This is insufficient for a VTS neurology specialist, as it does not adequately explore the nuances of proprioceptive deficits. This approach risks overlooking subtle abnormalities and is a failure to apply the advanced diagnostic skills expected of a VTS, potentially leading to delayed or incorrect treatment. A third incorrect approach is to interpret any limb weakness or incoordination as a proprioceptive deficit without ruling out other causes, such as orthopedic pain or primary motor deficits. This demonstrates a lack of differential diagnosis and a failure to apply a systematic neurological examination. Ethically, this can lead to inappropriate treatment and a failure to address the underlying cause of the animal's condition. Professional reasoning. Professionals facing this scenario should employ a decision-making framework that prioritizes systematic data collection and objective interpretation. This involves 1. Understanding the patient's history and current clinical status. 2. Performing a comprehensive neurological examination with a specific focus on proprioceptive testing and postural reactions. 3. Differentiating proprioceptive deficits from other neurological or orthopedic conditions through a process of elimination and targeted testing. 4. Documenting all findings meticulously. 5. Collaborating with the attending veterinarian to interpret the findings and formulate a diagnostic and treatment plan. This structured approach ensures that clinical decisions are evidence-based and ethically sound, promoting the highest standard of patient care. Question 17. Stakeholder feedback indicates a need for improved consistency in documenting neurological deficits observed during postural reaction assessments. A veterinary technician specialist candidate is tasked with evaluating a canine patient with suspected spinal cord injury. Which approach best ensures accurate, reproducible, and clinically relevant documentation of the patient's postural reaction deficits, aligning with VTS neurology standards and regulatory expectations for patient care? Option A. Describing the patient's postural reaction deficits using subjective and qualitative terms such as a bit wobbly or slow to correct. Option B. Relying solely on the veterinarian's initial assessment without independently verifying and documenting the patient's current postural reaction status. Option C. Focusing on the patient's overall demeanor and mobility rather than specific postural reaction deficits. Option D. Utilizing a standardized, objective grading scale for postural reactions and documenting findings with precise, descriptive terminology. Correct answer is D. Utilizing a standardized, objective grading scale for postural reactions and documenting findings with precise, descriptive terminology. Explanation. Scenario analysis. This scenario presents a common implementation challenge in veterinary neurology, where subjective assessment of postural reactions can lead to variability in documentation and communication. The challenge lies in translating objective observations of a patient's response to proprioceptive deficits into a standardized, clinically relevant format that all members of the veterinary team can understand and act upon. Inconsistent or vague descriptions of postural reaction deficits can lead to misinterpretation of patient progress, delayed or inappropriate treatment adjustments, and ultimately, suboptimal patient outcomes. This requires a technician to not only accurately assess the patient, but also to effectively communicate those findings within the established regulatory and ethical framework for veterinary practice. Correct approach analysis. The correct approach involves utilizing a standardized, objective grading scale for postural reactions, such as the modified hemisternal or limb placement tests, and documenting the findings with precise terminology. This aligns with the VTS Neurology credentials' emphasis on advanced diagnostic interpretation and skilled patient assessment. Regulatory frameworks for veterinary practice, including those governing veterinary technicians, mandate accurate record keeping and clear communication of patient status. Employing a standardized scale ensures that observations are quantifiable and reproducible, facilitating objective tracking of neurological deficits and response to therapy. This approach upholds the ethical obligation to provide competent care and promotes effective interprofessional communication, which is crucial for patient safety and well-being. Incorrect approaches analysis. Describing postural reaction deficits using subjective and qualitative terms like a bit wobbly or slow to correct represents a significant regulatory and ethical failure. Such descriptions lack objectivity and are open to individual interpretation, leading to inconsistent patient assessment and communication breakdowns. This violates the principle of accurate record keeping, which is a cornerstone of veterinary practice regulations. Furthermore, it fails to meet the advanced diagnostic expectations of a VTS candidate, who is expected to employ precise and standardized assessment methods. Relying on such vague language can lead to misdiagnosis, inappropriate treatment decisions, and potentially harm to the patient, thereby breaching the ethical duty of care. Another incorrect approach is to solely rely on the veterinarian's initial assessment without independently verifying and documenting the patient's current postural reaction status. While collaboration is essential, the veterinary technician's role includes independent assessment and monitoring. Failing to perform and document these assessments independently can lead to missed subtle changes in neurological status, which could be critical for timely intervention. This oversight can be considered a failure to uphold the expected standard of care and may contravene regulations requiring comprehensive patient monitoring by qualified personnel. Professional reasoning. Professionals facing this challenge should adopt a systematic approach. First, ensure a thorough understanding of validated methods for assessing postural reactions, including their sensitivity and specificity. Second, consistently apply these methods during patient evaluations. Third, document findings using precise, objective language and standardized scales. Fourth, communicate these findings clearly and concisely to the veterinary team, highlighting any changes from previous assessments. This structured approach ensures that patient care is based on accurate, objective data, promoting effective teamwork and adherence to professional and regulatory standards. Question 18. Quality control measures reveal that a veterinary technician specialist, VTS, in neurology is performing ultrasound examinations of the brain and spinal cord. The VTS is presented with a canine patient exhibiting acute onset of ataxia and proprioceptive deficits. The VTS has completed the ultrasound scan and is reviewing the images. Which of the following actions best demonstrates adherence to best professional practice for brain and spinal cord ultrasound evaluation in this scenario? Option A. The VTS relies primarily on the automated image optimization features of the ultrasound machine to ensure the best possible image quality, assuming the machine's algorithms are sufficient for diagnostic purposes. Option B. The VTS proceeds to interpret the ultrasound findings independently and provides a definitive diagnosis to the owner without consulting the supervising veterinarian, as the VTS has extensive experience. Option C. The VTS performs the ultrasound scan without a detailed review of the patient's neurological examination findings, focusing solely on obtaining representative images of the brain and spinal cord. Option D. The VTS meticulously reviews the acquired images, comparing them to known sonographic anatomy and identifying any potential artifacts. The VTS then correlates these findings with the patient's clinical signs and communicates any significant observations or concerns to the supervising veterinarian, including any limitations of the study. The correct answer is D. The VTS meticulously reviews the acquired images, comparing them to known sonographic anatomy and identifying any potential artifacts. The VTS then correlates these findings with the patient's clinical signs and communicates any significant observations or concerns to the supervising veterinarian, including any limitations of the study. Explanation: this scenario presents a professional challenge due to the inherent variability in ultrasound image quality and interpretation, especially in the complex field of veterinary neurology. Ensuring consistent, high-quality diagnostic imaging requires adherence to established protocols and a thorough understanding of the limitations of the modality. The veterinarian's responsibility extends beyond simply performing the ultrasound to ensuring the data collected is diagnostically useful and ethically obtained, aligning with the standards of care expected of a veterinary technician specialist, VTS, in neurology. The correct approach represents best professional practice because it prioritizes patient welfare and diagnostic accuracy through a systematic, evidence-based methodology. Adhering to established VTS neurology guidelines for ultrasound acquisition and interpretation ensures that the procedure is performed with the highest level of competence. This includes proper patient preparation, standardized scanning techniques, appropriate transducer selection, and meticulous documentation. The VTS's role in recognizing artifacts, understanding normal and abnormal sonographic appearances, and collaborating with the supervising veterinarian is paramount. This approach aligns with the ethical obligation to provide competent care and the regulatory framework that governs the practice of veterinary technology, emphasizing continuous learning and skill refinement. An incorrect approach that involves performing the ultrasound without a clear understanding of the patient's clinical history and neurological deficits is ethically problematic. This can lead to incomplete or irrelevant imaging, potentially delaying diagnosis and appropriate treatment, thus compromising patient care. It also fails to meet the standard of care expected of a specialist, who should integrate all available diagnostic information. Another incorrect approach, such as relying solely on automated image optimization settings without manual adjustments or critical evaluation, demonstrates a lack of technical proficiency and diagnostic acumen. This can result in suboptimal image quality, obscuring subtle abnormalities, or creating misleading artifacts, which can lead to misdiagnosis. This falls short of the VTS's responsibility to produce diagnostically sound images. Furthermore, an approach that neglects to document findings, including any limitations or artifacts encountered, is a failure in professional record-keeping and communication. This hinders the ability of the supervising veterinarian to make informed decisions and can impede future diagnostic efforts. It also violates the principle of transparency and accountability in veterinary practice. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition, a review of the clinical history, and the selection of the most appropriate diagnostic tools. For ultrasound, this means understanding the indications, contraindications, and limitations of the modality. It requires a commitment to ongoing education and skill development, adherence to established protocols, and effective communication with the supervising veterinarian. The VTS should always strive to obtain the highest quality diagnostic images possible and interpret them within the context of the patient's overall clinical picture, always prioritizing patient well-being and diagnostic accuracy. Question 19. Operational review demonstrates a consistent trend of suboptimal image quality in CT scans performed for suspected intracranial meningiomas in canine patients, leading to increased need for repeat scans and delayed diagnostic reporting. Which approach best addresses this implementation challenge while adhering to VTS neurology standards? Option A. Utilizing a generic, low-resolution CT protocol that is applied to all neurological cases, regardless of suspected pathology, to ensure efficiency and reduce the learning curve for staff. Option B. Relying solely on pre-contrast imaging and omitting intravenous contrast administration for all suspected intracranial lesions to minimize patient risk and procedural time. Option C. Implementing a standardized, high-resolution axial and sagittal reconstruction protocol with a specific intravenous contrast injection timing and volume tailored for meningioma detection, coupled with pre-scan patient assessment for renal function and potential contrast reactions. Option D. Increasing the M and decreasing the exposure time for all neurological CT scans to expedite the procedure and reduce anesthetic duration, assuming this will improve image clarity. The correct answer is C. Implementing a standardized, high-resolution axial and sagittal reconstruction protocol with a specific intravenous contrast injection timing and volume tailored for meningioma detection, coupled with pre-scan patient assessment for renal function and potential contrast reactions. Explanation. Scenario analysis. This scenario presents a common implementation challenge in veterinary neurology imaging. The core difficulty lies in balancing the need for detailed diagnostic imaging of complex neurological structures with the inherent risks associated with anesthesia and radiation exposure in veterinary patients. The pressure to obtain high-quality images quickly, while ensuring patient safety and adhering to established protocols, requires careful judgment and a thorough understanding of CT physics, patient physiology, and regulatory guidelines. The challenge is amplified by the potential for subtle neurological lesions that may be missed with suboptimal protocols, leading to misdiagnosis or delayed treatment. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic efficacy by tailoring the CT scan protocol to the specific neurological indication and patient factors. This involves selecting appropriate slice thickness, KVP, MS, and contrast administration based on the suspected pathology, e.g., suspected tumor VS, inflammatory lesion VS, vascular event. It also necessitates careful consideration of anesthetic depth, patient positioning to minimize artifacts, and the use of appropriate contrast media at the correct injection rate and volume. Adherence to established VTS neurology guidelines and institutional protocols ensures consistency, reproducibility, and optimal diagnostic yield, while minimizing radiation exposure and anesthetic risks, aligning with the ethical imperative to provide the highest standard of care. Incorrect approaches analysis. One incorrect approach involves defaulting to a generic, one-size-fits-all CT protocol for all neurological cases. This fails to account for the unique imaging requirements of different pathologies and patient sizes, potentially leading to insufficient detail for subtle lesions or unnecessary radiation exposure and contrast load for simpler cases. This approach violates the principle of individualized patient care and may not meet the diagnostic expectations for a VTS neurology specialist, potentially falling short of best practice standards. Another incorrect approach is to rush the scan to minimize anesthetic time, sacrificing image quality by using excessively high M or long exposure times that increase motion artifact, or by reducing slice resolution to the point where fine details are obscured. This directly compromises diagnostic accuracy and can lead to misinterpretation or the need for repeat scans, ultimately increasing anesthetic and radiation exposure. This approach demonstrates a failure to prioritize diagnostic efficacy and patient safety over expediency, which is ethically and professionally unacceptable. A third incorrect approach is to administer contrast media without considering the patient's renal function or potential for adverse reactions, or to use an inappropriate contrast volume or injection rate. This can lead to poor contrast enhancement, increased risk of nephrotoxicity, or adverse reactions, all of which compromise patient safety and diagnostic quality. This approach neglects critical patient assessment and adherence to safe contrast administration guidelines. Professional reasoning. Professionals facing this scenario should employ a systematic decision-making process. First, thoroughly review the patient's signalment, history, and neurological examination findings to formulate a differential diagnosis. Second, consult relevant VTS neurology guidelines and institutional protocols for imaging recommendations specific to the suspected pathology. Third, consider patient-specific factors such as age, size, anesthetic risk, and any pre-existing conditions that might influence protocol selection or contrast administration. Fourth, collaborate with the supervising veterinarian to confirm the chosen protocol and ensure all safety measures are in place. Finally, critically evaluate the acquired images for diagnostic quality and completeness, and be prepared to adjust the protocol if necessary, always prioritizing patient well-being and diagnostic accuracy. Question 20. The control framework reveals that when performing radiography for a neurologically compromised canine patient suspected of having a spinal lesion, an implementation challenge arises in achieving optimal diagnostic image quality while ensuring patient safety and minimizing stress. Which of the following approaches best addresses this challenge within the established veterinary radiography guidelines? Option A. Utilizing a combination of appropriate sedation, specialized positioning aids, and precise collimation to obtain diagnostic images with minimal patient discomfort and radiation exposure. Option B. Prioritizing speed of acquisition by performing only the most essential views, even if image quality is compromised, to reduce the duration of handling. Option C. Administering a high dose of anesthetic to ensure complete immobility, regardless of the specific diagnostic requirements of the radiographic series. Option D. Employing standard positioning techniques without significant modification, relying on manual restraint to achieve the desired views quickly. The correct answer is D. Employing standard positioning techniques without significant modification, relying on manual restraint to achieve the desired views quickly. Explanation. Scenario analysis. This scenario presents a common implementation challenge in veterinary neurology radiography, balancing the need for high-quality diagnostic imaging with the practical limitations of patient handling and safety, particularly when dealing with neurologically compromised animals. The challenge lies in ensuring that the radiographic technique, while optimized for diagnostic yield, does not exacerbate the patient's condition or compromise the safety of the veterinary team. This requires a nuanced understanding of radiographic principles, patient physiology, and ethical considerations for animal welfare. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic efficacy through careful technique selection and patient positioning. This aligns with the core ethical principles of veterinary medicine, emphasizing the avoidance of harm and the provision of competent care. Specifically, it reflects the VTS Neurology's responsibility to utilize advanced knowledge and skills to achieve diagnostic imaging while minimizing patient stress and risk. Adherence to established radiographic protocols for neurological imaging, adapted for individual patient needs, ensures that the generated images are diagnostically relevant and that the procedure is performed humanely and safely, in accordance with best practices and the implied standards of care within the veterinary profession. Incorrect approaches analysis. One incorrect approach involves prioritizing speed and ease of positioning over diagnostic quality and patient comfort. This could lead to suboptimal image quality, requiring repeat exposures, and increasing the patient's stress and radiation exposure. Ethically, this fails to uphold the duty of care to the patient. Another incorrect approach is to use excessive sedation or anesthesia without a clear diagnostic justification or risk assessment. While sedation can aid positioning, oversedation can mask neurological deficits, interfere with diagnostic interpretation, and introduce unnecessary risks, violating the principle of using the least invasive and safest methods. A third incorrect approach is to neglect proper collimation and shielding, leading to unnecessary radiation exposure for the patient and staff. This directly contravenes radiation safety regulations and ethical guidelines for minimizing radiation dose. Professional reasoning. Professionals facing this situation should employ a systematic decision-making process. First, assess the patient's neurological status and tolerance for handling. Second, consult established radiographic protocols for the suspected neurological condition, considering variations for patient size, temperament, and degree of compromise. Third, select the least invasive but most effective positioning and restraint methods, utilizing appropriate support devices. Fourth, optimize radiographic parameters, KVP-M as focal film distance, for diagnostic image quality while minimizing exposure time and dose. Fifth, implement strict radiation safety measures for both the patient and personnel. Continuous reassessment of the patient's condition throughout the procedure is paramount.